It's April the 18th, 2024, and it is 11:34 right now, and I'm doing this recording. So if this video gets up late again today, I don't know what to say. We've been trying to get our high-speed internet hooked up here at our house now since December. And the cable company, it's actually our power company, are the ones that ran the high-speed internet lines. South Carolina has been trying to get internet out to all the rural communities for quite some time now. It's like, I guess, like they made it a goal like 2 years ago in order to get more high-speed internet out to the rural places. And they finally ran the high-speed cable out here back in December, and we have been pushing and trying to get them to run the high-speed internet cable up to our houses on the road, but we live down a private driveway that's about a mile long, and we've been calling, trying to get them out here to set it up. And my wife finally called them this morning and paid the deposit, so any day now we should be getting hooked up with high-speed internet, and I won't have this problem anymore. My internet runs off one of those 5G cell towers that we use. And it's okay for streaming and stuff like that, but as far as like uploading videos, it just sometimes moves incredibly slow. In the past couple of nights that I've tried to upload, I started at like 3 o'clock and it's just taking forever to get up. I don't know why it's moving so slow, but hopefully here soon, guys, I'm gonna have my high-speed internet and we won't have this problem anymore where the videos get up so late. And I don't know, maybe sometimes if it's not YouTube that's causing the problems, or if it's my internet, I don't know. But hopefully this won't be an issue here soon. So I got my fingers crossed. I'll let you guys know as soon as my high-speed internet gets hooked up. And I've done uploads with high-speed internet. It takes like 10 minutes, but it takes hours with that tower. So I didn't mean for that to rhyme. Anyway, I'm just getting back from Columbia, South Carolina. I had to go up to the MUSC hospital up in Columbia this morning. We had to leave here at 6 o'clock a.m. today to get up there. I had to have CAT scans done today and blood work done. They're going to be looking at my pancreas and my liver and the tips that I had placed and the stents. They just want to make sure there's no clotting happening in there. And they want to take a look at my pancreas, see how that's looking and all that stuff. So April 22nd, I speak to my doctor. We're going to be doing I don't have to go down to Charleston for this. We're going to be doing a digital talk. I'm doing a digital appointment with him. So in a few days, I'll have some answers on my liver health and what's going on with all that. Hopefully, there's no blockage in there at all. If there is, they'll have to go in through my neck and through my groin and go in and clean that out. But since I do have the tips in there, it's pretty easy for them to get in, from what I understand, for them to get in and clear out anything if there is. And they said that they do tend to get clogged up sometimes. I guess because that's metal and it tends to stick in there, but they said it's pretty easy for them to remove any kind of clotting that might happen in there if it does. I'm hoping that there's not any. My last scan that I had done, I was completely good to go, but we'll see, and I'll let you guys know what they tell me when I speak to them. And they did blood work too, so I'm going to know what my liver health is looking like as well, and I'll let you guys know. But on the way up there today, my mom and I had a really long conversation. My mom came and picked me up and drove me up there. And in our conversation on the way up there today, we were just talking about, the fact that I've almost got 2 years under my belt now. And my mom is the one that actually brought it up. And she said, next month is going to be 2 years for you. And I said, yeah. And we got to talking, and she said, man, I'll never forget that first time you were in the hospital. And she was talking about when I was going through withdrawals, and I had DTs. I went through delirium tremens when I was in the hospital. And my mom was talking to me about it, and I figured why not make a video about this today. It was fresh in my mind, her talking to me about how confused I was when I was in the hospital. I was hallucinating. She said that I was saying that people were coming to see me that had not come to see me. She said I was coming up with all kinds of weird things. I was saying all kinds of stuff that did not happen. People coming to see me, I was seeing things in the room. Now, I have absolutely no recollection of any of it. The first week I was in the hospital, I don't remember anything. They did have me on a medical detox. I was on Ativan while I was in the hospital and a bunch of other drugs. But I was going through delirium tremens, and I was hallucinating. I don't remember any of it, but like I said, my mom said that I was seeing people, like actually having conversations with people while I was in the room, and there was nobody there. She said that I would just be talking to the wall, and I thought I was actually speaking to somebody, and I wasn't talking to anybody. And this is one of the really dangerous parts about alcohol, and this is why I always say, that if you're considering stopping drinking, you really need to talk to a doctor, because there's only two substances that can actually really take your life if you stop abruptly, and that's alcohol and benzos. You will, or you can lose your life by stopping taking them. Your body gets so used to those substances being in there that if you remove them abruptly, it can take your life, and you really need to talk with a doctor. I don't know if they do medical detox at home, like if they'll give you, it is getting so hot out here already, guys. But I don't know if they can, I don't know if they'll like allow you to take like Ativan home and take it. They might make you go in a hospital, but it all depends on what your doctor decides, the amount, the length, the duration of your drinking, the amount of alcohol you're drinking. It's really going to be up to your doctor. But with that said, it's a really good idea to speak with a doctor before you go to stop, because I couldn't imagine being at home going through delirium tremens, because it's scary. Excuse me. But I wanted to go ahead today and just talk about delirium tremens, what they are, what causes them, and what they can do about it. So let's go ahead and let's talk about today's video. So delirium tremens, or DTs. It is the most severe form of ethanol withdrawal, manifested by altered mental status, global confusion, and sympathetic overdrive, autonomic hyperactivity, which can progress to cardiovascular collapse. Minor alcohol withdrawal is characterized by tremor, anxiety, nausea, vomiting, and insomnia. Major alcohol withdrawal signs and symptoms include visual hallucinations, like I was just talking about, and auditory hallucinations, whole body tremors, vomiting, diaphoresis, and hypertension or high blood pressure. So what are the signs and symptoms of delirium tremens? Minor withdrawal is tremor, anxiety, nausea, vomiting, and insomnia. Major withdrawal, visual hallucinations and auditory hallucinations, whole body tremors, vomiting, diaphoresis, I'm sorry guys, diaphoresis or something like that, I'm sorry. Hypertension, withdrawal seizures, and delirium tremens, agitation, global confusion, disorientation, hallucinations, fever, hypertension, diaphoresis, autonomic hyperactivity, tachycardia and hypertension, and profound global confusion, hallmark of DTs. What are the treatments for delirium tremens? Supportive therapy. This important component of treatment of alcohol withdrawal syndrome and delirium tremens, or DTs, includes providing a calm, quiet, well-lit environment, reassurance, ongoing reassessment, attention to fluid and electrolyte deficits, and treatment of any coexisting addictions. Also, thiamine. Thiamine can be useful for preventing Wernicke encephalopathy, confusion, ataxia. I'm not even going to try to pronunciate that. An acute disorder caused by thiamine deficiency and Korsakoff syndrome, which we talked about last week, Memory impairment, amnesia, a late manifestation of thiamine deficiency. And we talked about thiamine deficiency last week as well. Magnesium. Alcoholic individuals frequently have a large total body deficits of magnesium, and symptoms and signs of magnesium deficiency include hyperactive reflexes, weakness, tremor, refractory hypokalemia, reversible hypothyroidism, and hypothyroidism, and hypoglycemia, and cardiac dysrhythmias. Benzodiazepines. Based on the Clinical Institute Withdrawal Assessment Alcohol Scale Revisited, CIWA-AR, or the Richmond Agitation Sedation Scale, RASS, very high dose bolus therapy with addition of phenobarbital as needed may help reduce the need for mechanical ventilation and the length of time in the ICU. So when they say they're the bolus, that I guess they're putting it in your IV bag. Intravenous ethanol infusions. These are not recommended for a word I can't pronounce, for treatment of alcohol withdrawal. So medications and delirium tremens. Various medications can be used in treatment and supportive care of delirium tremens, including the following: benzodiazepines, chlorodiazepoxide, diazepam, or lorazepam. Anesthetic agents: propofol, dexmedetomidine, ketamine, barbiturates, phenobarbital, and pentobarbital, and vitamins and nutrients: dextrose, thiamine, magnesium, and folic acid. So there are things that they can do for you when you're suffering from delirium tremens, but you have to go to a doctor in order to get those treatments. The last thing you want to do is try quitting drinking and be alone and then have something like this occur, because you're not even going to know what's happening. You're going to be so confused that it can just, it just come on and you wouldn't even know it. From what I understand too, the condition can start after about 2 or 3 days. And when I went through my DTs, I had already quit drinking for a couple of days before I went to the hospital, because I was just so sick. I could not drink. I kept throwing up. I was throwing up blood, and I mean, there's no way I could have gotten it down during that period of time. And I knew I was very, very, very ill. I didn't really go into the DTs until I got to the hospital, because I do remember being here. I remember laying in the bed. I remember being extremely ill. It's not until after I got to the hospital and all that stuff that the DT set in, and I started really hallucinating. I didn't know what was going on. And like I said, I have no memory of it at all. I just have absolutely no memory of that experience. And it's something I don't ever want to go through ever again. Let me read this right here. And this is from WebMD about delirium tremens. Delirium tremens, also called DTs or alcohol withdrawal delirium, AWD, is an uncommon, severe type of alcohol withdrawal. It's a dangerous but treatable condition that starts about 2 to 3 days after someone who's dependent on alcohol suddenly stops drinking. You are more likely to have DTs if you have moderate or severe alcohol use disorder, heavy or frequent alcohol use, even if it causes physical or emotional harm. Nearly 1/3 of U.S. adults will have alcohol use disorder at some point in their lives, and it is estimated about 1% of those may get delirium tremens. If untreated, delirium tremens can cause severe symptoms including heart attack, stroke, and death. How long does delirium tremens last? DTs usually last 2 to 3 days, but symptoms may linger for months in severe cases. That's unbelievable. Your chances of recovering sooner and having a good outcome are better if you get treated quickly. have more moderate alcohol use, and don't have other medical issues such as dementia or heart disease, which could complicate the condition. Delirium tremens causes and risk factors. Alcohol is a depressant and it slows your brain and nervous system. When you suddenly stop drinking after a long period of alcohol use, your brain and nervous system can't adjust quickly. Your brain gets overstimulated. People with alcohol use disorder who suddenly stop drinking may also have a spike in an amino acid called glutamate. Glutamate causes some common delirium tremens symptoms such as a sudden extreme spike in blood pressure, tremors, severe excitability, and seizures. You are more likely to have delirium tremens if you are an adult man or assigned male at birth, AMAB, especially if you are white, younger, and unmarried, have a history of seizures, have gone through alcohol withdrawal before, are a heavy long-term drinker, you've used alcohol for more than 10 years, which was me. And I mean, everything here is me except for the fact that I'm married. Have another substance use disorder when you stop alcohol use, I didn't. Or over the age of 30, which I was. And have a medical condition such as liver or cardiovascular disease. And I did. I had liver disease. I had cirrhosis. I just didn't know it at the time. Heavy drinking is usually considered consuming 4 or more drinks in one day or 8 in a week for women and people assigned female at birth, AFAB. For men and those AMAB, heavy drinking is 5 or more drinks in a day and 15 in a week. 15 drinks in a week. I had 15 drinks in an afternoon. One standard drink is considered to be 12 ounces of beer, 8 to 9 ounces of malt liquor, 5 ounces of wine, and 1.5 ounces of 80 proof liquor or distilled spirits such as vodka, rum, or whiskey. If you drink enough alcohol to be considered a heavy drinker, especially if you've done it for 10 years or more, and you want to stop completely, talk to your doctor. Delirium tremens isn't curable, but it can be treated to help you manage symptoms and avoid complications such as dehydration. And let's just go through what they say here on WebMD about delirium tremens symptoms. If you are going to have delirium tremens, usually symptoms start between 2 and 4 days after your last drink. So that was me. I was about 4 days in when I started having the delirium tremens. However, many symptoms may not show up until up to 10 days after you give up alcohol. There are a whole range of symptoms, including both physical and psychological issues. Tremors or shaking, hands and feet, chest pain, deep sleep that lasts a day or longer, and I slept the whole entire time I was in the hospital. Dehydration, fever, I had fever too. Heavy sweating, I was sweating profusely. Nausea or vomiting, I was throwing up nonstop. Other tremors, including muscle tremors, I was shaking like crazy when I had gotten sick. Pale skin. My skin was so pale during that period of time. Just going through this list right now, I'm thinking to myself, I mean, I checked all these boxes. Passing out, problems with eye muscle and movement, rapid heartbeat, seizures, sensitivity to light, sound, and touch. I remember being so sensitive to the light, and those lights in the hospital are so bright. I had to close my eyes because it was bothering me so bad. Delirium tremens can cause your body temperature, breathing, or blood circulation to change quickly. This could lead to life-threatening complications such as sepsis, which I've had, irregular heartbeat, trouble breathing, seizures, or an electrolyte imbalance, a condition when the minerals that control your body's functions are out of whack. Psychological symptoms include confusion, which I said I was completely confused, excitability or anger, and they were telling me that I was very angry when I was in the hospital. I was getting mad and yelling at the nurses for no reason. And like I said, I have no recollection of this. I don't remember any of it. Nightmares, severe hyperactivity, sleepiness, stupor, or fatigue. Delirium tremens hallucinations. Another symptom of DTs is hallucinations. These happen in a very small number of people during withdrawal. And, the thing is, too, is that Slayer Sober, you guys all know who he is. And if you don't, go check Slayer Sober's channel out. That's his channel's name is Slayer Sober. Just look up Slayer Sober in your YouTube search bar. He'll be the first one to pop up. He does videos about alcoholism as well. He was on this channel a few weeks back. If you're new here, we did a talk, and I think it's 4 episodes long. Each one's about 30 minutes. But Slayer Sober is a really cool guy, and I like him a lot. But he's like late 20s and was having hallucinations after he stopped. So you don't have to be a lifelong drinker, you know, in your 60s and you drink your whole life and to have DTs. It can happen to anybody. So it's one of those things you gotta be very careful about, but let's get back to it. Even less often, people see, feel, smell, or even taste things that aren't real. Hallucinations during withdrawal tend to begin shortly after stopping alcohol use, typically emerging within 12 hours up to about 3 days. You are more likely to have hallucinations along with other DT symptoms if you are a long-time drinker, are using other drugs such as methamphetamines or cocaine, have a history of mental health issues including depression, post-traumatic stress disorder, or bipolar disorder, or live alone. And guys, I've talked about this, but the majority of us were self-medicating with the alcohol. Either we had depression or anxiety or something like that. You really, if you are thinking about stopping drinking, please go see your doctor. You do not want to go through this. There are methods that they can use, we just went through, that they can help you through. And they can help you out a lot. The last thing you want to do is go through DTs. It can actually take your life. And if you're trying to quit drinking, it's because you're trying to better yourself and you're trying to make your life better. So why would you want to put yourself in a situation where it could threaten your life? And what's the point in doing it then? You went through all this trouble for no reason. This is one challenge to getting treatment for DTs. If you have hallucinations and confusion, you may not understand that you need to see a doctor. Someone with delirium tremens needs immediate attention in the hospital. Call 911 if you or someone you know has symptoms. So, delirium tremens diagnosis. Your doctor will start with a physical exam and medical history. They may also give you, for a caregiver or loved one who's with you, a questionnaire called a Clinical Institute for Withdrawal Assessment for Alcohol Revised Scale. This can help them determine your symptoms and measure your severity of your withdrawal. A score of 15 or higher means you're at risk for delirium tremens. Other tests that your doctor might do include blood magnesium level, blood potassium level, electrolyte levels, an EEG to test brain activity, lumbar puncture test to examine spinal cord fluid, metabolic panel, an MRI to look for signs of seizures or head injury, toxicology screen, blood or urine. Doctors may also check your liver, heart, nerves, in your feet and your digestive system to figure out the level of alcohol damage to your body. You may also be low on vitamins because of an unhealthy diet. Just like I was talking about yesterday. When we drink for long periods of time, we are vitamin deficient majority of the time. Our body can't absorb, it can't process the vitamins, the minerals, and we don't eat properly. You know, I've talked about this over and over again. You guys know what I'm talking about. You do not eat a big meal when you're trying to get drunk because it just defeats it. You got a full belly of food, you're trying to put drink in on top of that, you're just not going to get anywhere. So we don't eat. Then we end up getting so drunk to the point that we pass out, and then we end up not eating all day. Delirium tremens treatment. Symptoms of DTs tend to begin soon after you stop drinking alcohol and can happen abruptly. Because of this, it's best to talk to your doctor before stopping alcohol use. They can help you set up a plan to manage your alcohol withdrawal symptoms. If you have stopped using alcohol, haven't talked to your doctor, and think you might have DT symptoms, call 911. Delirium tremens treatment begins at the hospital. The treatment aims to help relieve your symptoms, reduce the chance of complications, and, if DTs are bad, save your life. Sedatives, usually benzodiazepines or medications used to treat alcohol withdrawal in DTs. They can help calm your excited nervous system. If your symptoms can't be managed with sedatives, your doctor may prescribe anesthesia so you will be completely sedated until your symptoms end. You may also need intravenous fluids with vitamins and minerals to treat dehydration or bring your electrolytes back to balance. Other drugs in the hospital used to treat acute DTs symptoms include antipsychotic drugs to help calm you and prevent hallucinations, anticonvulsants to stop seizures, blood pressure medications, drugs to regulate your heartbeat, and pain medication. You may need to stay in the hospital for up to a week to stabilize your health. After that, you should get treatment for alcohol dependence. The Government Substance Abuse and Mental Health Services Administration has an online treatment facility locator at findtreatment.samhsa.gov, or you can call their helpline at 1-800-662-4357. Cognitive Behavioral Therapy, or CBT, or recovery support groups such as Alcoholics Anonymous may help you stay sober moving forward. You may be concerned about having DT symptoms or nervous about seeking treatment. Your doctor and other providers aren't there to judge you, but are there to manage your symptoms and improve your chances of recovery. So, and right here are some complications of delirium tremens. Aside from symptoms of delirium tremens, you may also have other complications after stopping your alcohol use. These can be short and long term, and your doctor can help you manage them. They include seizures, irregular heartbeat, falls or injuries caused by confusion or seizures, side effects from the medication you take to relieve symptoms which will vary depending on your treatment. Another potential complication of DTs is Warriyo syndrome, which we talked about last week. This symptom is caused by the lack of thiamine or vitamin B1 and can be a result of long-term alcohol misuse. Symptoms of Warriyo syndrome include long-term memory loss, tremors, vision problems, hypothermia, and coma. Delirium tremens prevention. The only way to prevent delirium tremens is to stop or dramatically reduce your alcohol intake. The best way to prevent severe symptoms after you stop drinking alcohol are close supervision by your doctor and treatment that usually includes benzodiazepines. So, with all that, guys, if you've thought about stopping drinking, if you've already quit and you're months out, you don't need to worry about it probably. But if you just quit a day ago, guys, there's a window here. It said 2 to 4 days. It could be a week until you start getting delirium tremens to start to set in. If you live alone, you do not want to be at home alone having this set in. You're going to be confused. You're not even going to know what's going on. Please go see a doctor. It's just not worth not just trying to do it on your own. I know how scary that it is. I really do. I used to never go to the doctor. But guys, I'm telling you now that I didn't go to the doctor when I was, before all this, now I go to the doctor all the time. It's at least once a week I go to the doctor, sometimes a couple times a week. I've had multiple procedures because of this. It's because I decided not to go. Be proactive. Just go see a doctor. I know it costs money, but it's worth it. There are so many people that I see on here that found out they have fatty liver disease. That's reversible. They went and got checked out. They didn't let it progress all the way to cirrhosis. Now they know, and they have the tools and the methods to reverse it. If you don't know, how do you know? And like I was saying in yesterday's video, knowledge is power. Go see a doctor. Find out what's going on with you. Let them determine what they want to do. Because at the end of the day, you're important. Your life matters, and you are loved. And if you don't hear it from anybody else, you can hear it from me today. I love you, and I want to see you still be here. And I want to see you happy and healthy. And all it takes is a simple going to see your doctor and let them make that decision on what they decide they want to do with you. But please get that done, because stopping drinking abruptly is very dangerous, and it can cause a lot of problems, and it's just not where you want to be. So, guys, with that said, I'm going to go ahead and hop off of here for today. We're at 30 minutes right now. I just wanted to talk about delirium tremens because, like I said, I was talking about it with my mom on the way to the hospital this morning and on the way home. And she told me some stuff I just didn't know. I didn't remember it all. and it's really scary. But I'll be having some answers here really soon about my liver health and what's going on with that. And it's crazy too. It's my daughter's birthday today. She turned 20 years old today. I can't believe that I've got a kid that's 20. It's just amazing, and I can't believe that I'm still here to see that. Because there was a time I really didn't think I would be. I didn't think I was going to see her 20th birthday, and it was because of alcohol. And I'm here, and I'm so blessed to be here another day, and another day here talking with you guys. Alcohol completely screwed my life up. It really did, and it's never going to be the same because of it. And for any of you out there who are struggling with it right now, I know how hard it is. But there is a way out. And like I said, if I can do it, anybody can. Because I was that bad. I really didn't think I was ever be able to get it out of my life, but I was able to do it, and my life is so much better now. It is so much better. Your life can be so much better too. And for any of you guys that are out there who have removed it, I'm so proud of you. And I'm going to keep saying that every day. Guys, I love every single last one of you. Thank you for being here today and watching today's video. And hopefully this video got up before 9 o'clock tonight. It is right now 5 after 12, and I'm about to get this video processed, and it's going to start uploading. So if this video gets up late tonight, it is not my fault. And I'm just so you guys can see, it is just a couple minutes after 12. So hopefully this video will get up for you guys at a decent time. So with that said, until I see you in tomorrow's video, y'all have a great day, and I will see y'all then.